Welcome to the second episode of Black Girls Blueprint to Maternal Health, a series brought to you by Revive Community Health Center in partnership with Black Millennials for Flint. I am your host, Catrina Tillman. I am the Executive Director of Revive Community Health Center, located right here downtown Flint, Michigan. In observance of Women's History Month, tonight's episode will center around Black maternal health, past, present, and future, and the intersections of reproductive justice, environmental justice. I'd like to welcome our special guests and allow them to introduce themselves. Good evening, everyone. Welcome, welcome, welcome. I'm really excited to have you all. We'll turn it over to you, Miss Yvonne.
Thank you. Good evening, Catrina, and it is a pleasure to be here with you this evening. My name is Yvonne Lewis. I am the founder and CEO of the National Center for African American Health Consciousness. The purpose for this is that I started working in 1987 looking at disparities in health and was amazed at how much information we didn't have about our own health and well-being. So the motto is, the awakening begins with you. If we can awaken, become clearly aware and consciously of the things that are going on around us, we can change our community one heart at a time.
Great. Thanks so much, Miss Yvonne. Over to you, Vanessa. Welcome, welcome, welcome.
Thank you so much. Hello, everyone. I'm Vanessa Vassal. I'm the National Programs Director for Maternal Health and Environmental Justice for Black Millennials for Flint. And I'm so excited to be a part of this conversation. And of course, for Black Millennials for Flint to continue to partner with Revive moving forward. So thanks so much, Catrina, for having me be a part of this.
We are excited to have you. And last but certainly not least, Miss Miajanell, welcome to Black Girls Blueprint. We're excited to have you. Go ahead and introduce yourself.
Thank you. I'm honored to be here. My name is Miajanell Jasmine Peake. I reside in Memphis, Tennessee, and I'm the founder of Peake Wellness, which is a private doula agency with the mission of really just centering women of color to ensure they make informed decisions, evidence-based decisions through the most vulnerable state of many of their lives, which is pregnancy. So thank you so much for having me.
Awesome. Thank you all so much for those amazing introductions. And as you all can see, this panel is full of wealth and knowledge and experience. So I'm really excited to get into this conversation. So let's go ahead and just jump right into it. And the first question that I wanted to ask you all, and we can kind of do popcorn style, whoever wants to jump in on the answer, we can just kind of flow in that manner. Doulas, midwives, and ancestral birth workers have preserved the health and safety of birthing people and their infants for generations. There has been a recent increase in Black women going back to our roots and seeking out the support and services of these traditional caretakers due to being more respected and empowered during pregnancy and the sacred birthing process, especially during the COVID lockdowns. We definitely have seen an increase of that. Please share with us more about what you do as a birth worker or just being in this space of maternal health and the impact the health outcomes have on Black families.
I can go. I eat, sleep, and breathe birth. So anytime that anyone says anything about doula, I just raise my hand. So the word doula itself is a new word, but I believe particularly Black families have always had someone to really assist them. So I'm excited about people getting the word out around doula work. It is evidence-based. Evidence shows if you have a labor doula, it increases chances of breastfeeding, it decreases chances of postpartum depression, and just really increase the chance of a true better outcome when it comes to pregnancy. I always like to say, you're pregnant, your partner, your mom, your husband is not a doula. They are there to really assist you with loving you, right? But it's really good to have an unbiased person in the hospital, home, or even at a birth center to really give you informed decision about the process. Historically, in our community, we have a lot of misconceptions about birth, right? So it's really good to have someone right there to what I call unlearn and relearn a lot of process around birth, right? So we kind of think that birth is this most traumatic experience, right? And it doesn't have to be that. It can actually be a beautiful experience, right? So I'm not a doula that say that you're going to see unicorns and it's going to be great. I'm not that. You will feel pain, but my goal is to really reduce the chances of suffering, right? So you have a beautiful baby at the end of it, right? And you don't have to suffer, right? So I'm excited the word is getting out about doulas. Throughout COVID, it's been a lot of like regulation around what a doula is and certification. But I think, the word is out and the evidence shows that you really need a birth expert in the room, especially when we talk about marginalized people. Yeah.
That's great. It's interesting. I'm a mom. We have 4 boys, and it wasn't until recently, my oldest is 13, my youngest is 4. And it wasn't until recent that I even heard about a doula. None of my doctors even presented that as an option for me to have in terms of having an advocate there on my behalf in giving birth. And so the work that you do is so important. Especially as I stated earlier, in today's time with COVID and certain hospitals having restrictions on how many family members you can have in a room with you, due to COVID restrictions, but being able to have someone there that can speak up on your behalf is very important and very much needed during the time, especially giving birth, which can be a frightening time, especially if you're a first-time mom. So thank you so much for what you do in that particular area. Vanessa or Yvonne, did you all wanted to?
Yeah. So Catrina, I want to appreciate you for saying in this space, because not a doula. However, I cut my teeth in public health I'm going to date myself here, in 1987, working with women who were substance users and trying to identify places that they could go to get the kind of support that they need and what we had to do to work with them. So one of the things I learned during that period was the importance of having someone with you. And so we started a program that we called Moms, when we was mentoring other mothers. And this is a program in Saginaw. And what we did was work with older women who had already had their children, and some of them feeling as if, well, I'm over the hill, I've had my children, I don't have anything else to give. And we work with them and help them prepare to work with moms who didn't have anybody to work with them and to give them some of the insights. Now, I was born in a generation just after the time when Black women could really go to the hospital somewhat comfortably. So all of my 11 brothers and 10 of us were born in a hospital. But what we learned was that history of having the midwives and knowing that you had somebody there with you when you talk about that ancestral piece. So the other thing, when we transitioned to work here in Flint, which is, I've been here in Flint longer than I was anywhere else in my life, but we also had a maternal infant health advocacy program, because what we learned from my experience in 1987 to now is African American women we were experiencing more birth deaths, disparity. Our babies were dying 3 times more often, and often the moms were experiencing either death or long-term complications of challenges during that delivery process. So again, having the maternal infant health advocates working closely with moms through that pregnancy was really, really important to help us reduce the infant mortality rate in Flint. At least for a season, we were able to reduce that infant mortality rate. So I think this process of getting back to our roots, having somebody to walk with you and talk with you and having that life experience to go along with it is significantly important to changing the dynamic that we see now in increasing maternal and infant deaths.
I can piggyback. Oh, go ahead.
History. No, I was just saying that's a rich history. Go ahead, Vanessa.
No, I was just gonna piggyback off of that and say that, I'm so glad you highlighted this idea of that maternal experience being the wisdom moving forward, especially since, the theme tonight is past, present, and future. And this idea that mothers may not have someone oftentimes is focused so negatively in the context of they don't have a male partner, versus focusing on grandma, focusing on auntie, focusing on even the experience, even the other children, right? Because there are women who are having children safely at many ages, and so they may have an older child or an older daughter in her teens or 20s, and then have small children and becoming a mother again. So as it kind of pertains to this conversation, because I don't want to reiterate some of the wisdom that's already been shared about, the significance of doulas, the significance of public health programs. But what I want to kind of add is this idea of this common thread of sisterly advocacy, and this common thread of folks who have dedicated something about their profession toward the survival of other Black women. And I think, for Black millennials, for Flint, as well as kind of for myself, I think we have found this really unique niche, if you will, over the course of the last couple of years to kind of be the advocate for the advocate, right? Because, Miajanell mentioned that, a doula is the advocate and the voice for the family in that environment. And we have community programs such as Ms. Lewis's program that can be the voice for families in the community. But when we think about policy, and we think about that kind of advocacy, ourselves, as well as, Revive, we want to be the change to be able to open those doors for doulas to be in rooms where the door is shut, especially after COVID, for a variety of reasons that are sometimes legally based, sometimes, based on policy, but rarely scientifically based, right? Rarely centered around the health outcomes of what would be ideal for the mom and for her new baby. But, we've been very, very fortunate to be a part of coalitions and conversations around if there was going to be a maternal mortality review committee, who's a part of that conversation. There should be a doula in the room. There should be a midwife in the room. There should be a mom in the room. It should not just be a bunch of, with all due respect, a whole bunch of MBAs there, right? It should not just be a whole bunch of epidemiologists. I am an epidemiologist myself, and I am a doula, so I can speak on this. And I'm working on my MBA, so I can speak on this. But if we don't have a balance, and it's a room full of men, a room full of white men saying, this is the best policy for our nurses, this is the best policy for our obstetricians, this is the best policy for our hospital, are they also saying, well, how do we improve these outcomes for the death specifically of Black mothers, of the death specifically of new Black infants? And I really want to emphasize that because, Miss Lewis was talking about her work, in the 1980s, but the outcomes that we see today are worse than they were in the 1960s. So her work is helping as much as it can. These 21st century doulas work is helping as much as it can. But, we had, the Black Panther Party for Freedom, and we had, Stokely Carmichael and people, putting out flyers about 2 to 3 times, Black women are dying 2 to 3 times as much as white women. And we have some communities where the numbers are 5 times as much. We have places literally in New Jersey, not even in the South, where we have women dying at 8 times the rate of women in other counties in the same state. So we have to think about, there are many of us who have our head down in the trenches. There are many of us who are rocking babies and wiping tears, but who's standing up for them? And if you are in law, if you are in policy, if you're an undergraduate student trying to figure out what's next, if you don't know what you want to do, but you want to be in health, but you don't want to go to med school, there is this really important space in policy and in safety that is saying, what is the future of making sure that Black women survive and that Black babies survive?
That was really good. And my mind went to the Momnibus bill. We partnered with Black Millennials for Flint. They are all about advocacy and changing laws, especially in spaces like this and environmental justice. And so we definitely were able to contribute our 2 cents, so to speak, in terms of what we would like to see change. And one of the things that I remember that we advocated for was specifically for doulas, in terms of ensuring that they receive proper pay, and that mothers are able to definitely get the information that they need regarding of what a doula is and being offered doula services. And that's one of the things that we do at Revive Community Health Center. Miss Yvonne definitely spoke about helping bringing down those numbers, especially in the Flint and Genesee County. And with our Revive Village program, it's a free program where we offer services to expecting mothers to help mitigate those numbers. So I kind of want to talk a little bit about COVID, because we're definitely in COVID season. And just kind of want to get you all's perspective as it pertains to, I know within our culture and our history as African Americans, when we think about vaccinations and when we think about the Tuskegee experiment, right? When we think about government kind of forcing certain things on us, how are you all taking this in, especially in this space regarding maternal infant health, and especially knowing the research that pertains to COVID, the vaccinations, and how it can affect both mom and baby?
Catrina, I think that's a really good question, because I think we often have to contextualize these issues, because when we talk about Tuskegee and that public health service experiment at Tuskegee, it was so different than what we're talking about now with a virus that is at epidemic proportion. When men were denied in the Tuskegee situation, they were denied a treatment that was known to cure the disease. And here we are in the midst of COVID, when we didn't even know what it was, didn't understand that it was an airborne virus, and we're all being affected by it in different ways, because our bodies are different and the virus attacks in different ways. However, what we have learned over the time, even though the messages are mixed, and in some cases just flat out erroneous, the data isn't always clear. This is why I think it's so important for us to become consciously aware and be good consumers of information, and especially data. But one of the things we've learned when we looked at the vaccine and the studies that were done, the vaccine itself doesn't pass through the placenta. However, those antibodies do. So really, when a mom or pregnant woman gets the vaccine, they're actually given a gift. As one of my epidemiologist friends says, they're giving a gift to their unborn child, because we know right now we can't vaccinate children 0 to 5. But that gift that a mother can give that child. But when we hear these messages, and some of them intentional to steer us wrong, particularly in Black and brown communities, and we get afraid of making sure that we understand what's being said to us, that we don't often take the necessary steps to improve our own health. That's where, again, when I think about this, when I started the National Center, it was because in 1987, I looked at this data. African-American babies are dying 3 times the rate. Maternal rate is up. In 2006, in 2002, African-American babies are dying twice the rate. We have got to change this. And the only way is to thinking about what you said, Vanessa, is to help ensure we got quality information. We have to know that these challenges exist. And Miajanell, as you're saying, we have to know that we have the power to do something to change things. But without that knowing, the cycle continues. So I'm hoping in the world of COVID, we can have conversations that are clear and help us make quality decisions. Even when we're a little bit afraid and skeptical, ask that tough question. Get your questions answered so you can make the best decision for you, your baby, and your family.
Yeah, I mean, I 100% agree about the quality and also representation. I feel like marginalized individuals, particularly Black people, are rightfully afraid, right? Historically, we have been done wrong, right? But I also believe that this is the reason why representation, people getting the policy, people getting to these sciences, that we can have an ally in these rooms, right? So, it's been a case by case, and really listening to a lot of patients, pregnant people around their concerns around COVID. But as Ms. Lewis said, being a good consumer and really just eating the meat and throwing out the bones. There's so much stuff out there that's not true, that it can be hard to make an informed decision, right? But that's why I lean on representation and having individuals that, look like me, that I can possibly trust in those rooms, that make a decision for my community.
I think I'll add just a little bit to that, which is all this conversation about health equity, and all this conversation about equitable approaches to addressing misinformation goes to, in my opinion, goes to what Miajanell is saying about representation, because sometimes I feel as if the very valid fear of Black families is sometimes thrown back into our faces, and companies try to make it seem like we don't have a good reason to be fearful, instead of utilizing the resources to address the fact that there are very, very untrustworthy institutions that are, unfortunately, the distributors of the correct information, or are the distributors of, the resources that we need to access. That does include the federal government, that does include universities, that does include county health departments. And, the reason why, when we do have this conversation, the Tuskegee experiment does come up, is because there's a lack of justice that we still don't have justice for that situation. We still don't have justice for the family of Henrietta Lacks. We still do not have justice for the Black families in the 80s and 90s who had medications experimented on their Black boys for hyperactivity, right? Like, we still don't have justice for these things. And so, it's still both, it's not an issue of fact and fiction sometimes, as it is literally of like trauma and like heartbreak and like multi-generational disappointment. And I think we could do so much better than, we have a Black doctor who invented the COVID vaccine, and have a Black Dr. Fauci, and be considering the people that replace the people in leadership with younger folks, or with people of color, or with folks who actually have had that experience. I know that's kind of an aside, but it is very important, because I feel as if, let's say, hopefully COVID somehow evaporates and disappears in a year, whatever the next thing is, someone is still going to say Tuskegee, right? Like, it's not going to go away. So we do need to have consideration of past, present, future, as it pertains what really is health equity. Well, going back Sankofa to the past, so that we don't have to revisit it again, so that we don't repeat it. And I just think that it can be very insulting to downplay the fact that misinformation starts with sometimes white folks, but often just these larger institutions not being just, and unfortunately not necessarily being trustworthy, and then kind of gaslighting Black folks into making us feel like, well, since the facts are available, you shouldn't feel that way. No, that's, in my opinion, not the way to effectively address COVID, the next thing, going to the moon, whatever it is, in a way that's going to have increased participation in our health, increased participation in what's for the greater good. Because I will say, the last thing I'll say on this is, I think something very unique about COVID is that this is something that we were like, well, if one person does something, then it'll affect others, this herd immunity idea. And that obviously is not the same as something that happened with the Tuskegee syphilis experiment. But if there's something else where it's like, well, what's the greater good? Black folks are like, what greater good? Where's our greater good, right? So I don't know. I just kind of wanted to add that.
But you make a very important point, Vanessa, when you say that, and which is one of the reasons why I think these kinds of conversations are so incredibly important, is because when you have the conversation and you can raise that level of concern and actually tease it out, and then again put things into context, you can find the places where for yourself and for others we can make better decisions. But I think the other thing that's really important is that we have to be consistent in getting the voices heard. To your point, Miajanell, we have to be at the table. Someone once, that old saying that says, you're not at the table, you're going to be on the table. And that's how we felt all of these years. But now we have a really, really incredible opportunity to be at tables and speak voices that will give clarity to the issues past, present, and potentially future, because we're much better informed about the context of the conversation, as well as what possibilities we have to truly make a difference. So I'm appreciative of being at this table tonight with you young ladies.
Well, we're glad to have you here. No, I think that you all made excellent points, just in terms of how we communicate, not only to one another, but the responsibility that the public, the government, has in terms of communicating to us, especially because we have so many health disparities within our community. But yet we're always the first ones on the table to get vaccinations and to be suggested that our community needs to take these vaccinations first. And so that's really the point of Black Girls Blueprint to Maternal Health, to be able to have a space for expecting mothers and those that are within this space, whether it be a doula, or a doctor itself or a researcher, to be able to hear directly from this community pertaining to different situations such as COVID and how it affects pregnant moms, and having a safe place for expecting moms to come and gain information from experts such as yourselves. Speaking of justice, reproductive justice and Black maternal health are often used interchangeably when discussing Black women's health. However, there are many women who have chosen not to become mothers, have experienced risk factors associated with infertility, or have had their choice to become a mother taken from them by illnesses such as cancer or unnecessary hysterectomies. How do you include all women in the conversation about reproductive health and wellness while being sensitive to every person's choice to become or not to become a parent?
I think for me, it's been a learning curve, to be honest, but I think currently now, understanding that you have to center the community, right? With all the work that you're doing, and ensuring everyone has a voice in moving the envelope, right? So, my business, we focus primarily on pregnant individuals, but I always say you may be co-parenting with your grandmother, right? You may not have a partner, right? She has a say, right? They have a say, all these individuals. And even when we have prenatal sessions, I'm asking them to bring in their community, right? Like bring in their sisters, because not only, and that's why I think it is a lot of misconceptions around birth, because normally those conversations are hidden, right? Or we say the things, we say the negative things, and not thinking about it. We just say the negative things about birth. But if we bring in that conversation and make it more of a conversation that everyone's invited, it really heals the entire community, right? So, even with the prenatal sessions, like I said, I do bring in, everyone, because everyone's going to babysit, everyone's going to, love on that baby. So it's very important because they start thinking about how can I give this information to someone that could possibly help them. Right. So I just don't, I don't prescribe to the notion that you have to silo and have a target population, because if you center the entire community, everyone wins. So, and again, it has been a learning curve, like even with my language around pregnant individuals, making sure that I'm including trans individuals and all those things with my work. But, just having it truly centering the community has been extremely beneficial for everyone.
I can add something to that, that Black Millennials for Health, Black Millennials for Flint's maternal health branch has been doing is we recently launched our beauty shop talks. We've been doing barbershop talks for a while, but in these beauty shop talks, we kind of start the conversation with like, everyone here is somebody's support system, right? And the idea that, women's health, maternal health, if we don't necessarily focus on, well, this is about you, and we say this about somebody you love, this about somebody not only does that bring everybody into the conversation about support, but it also allows people to kind of ask those questions, and you can be like asking for a friend, you know what I mean? Like, oh, it's not really about me, but it's about somebody I know, you know what I mean? And I think that this idea that that there's shame associated with not being a mother, or there's a shame associated with losing a child or losing a pregnancy. I think we need to get away from that, and I think B, one of the ways that we do get away from that is that we don't really focus on the messaging of society, but the messaging of like us as a village and us as a tribe. And it's even if you don't have the right words, I think Miajanell made a good point, because I always talk about my challenge with improving my language around pronouns and LGBTQ community, and like, different expressions of motherhood, different expressions of parenthood and pregnancy, and how I'm still strengthening my conversation in that. In this idea of like bringing everyone as a part of the support, you're really able to sharpen each other's iron. And so I'll actually share kind of like sort of a sort of small story. We had a beauty shop talk recently, and somebody asked about circumcision, and asked, as an auntie, as a grandmother, as someone, not as the parent of the child. And that kind of branched out to like, everybody may have an opinion about what somebody else is going to do. And this is another one of those situations. You may have an opinion about somebody being 35 and not having any kids, or have an opinion about a couple being married and not having any kids, or, whatever the idea is, but that is their choice. And I think people are doing a better job, in my opinion, of focusing on the issue and not the person. But I'm also kind of an optimistic person in that. But as long as, conversations around the information, conversations around love and support, conversations around positive intention, we can be as inclusive as possible. Now, we do got to cut off toxic people, though, because if Big Mama is have some old-fashioned mindsets, maybe she should stay in the waiting room or whatever. Or if you do want to go to the OBGYN and ask certain questions, don't have the person come with you that's always asking you about having children. Talk to your OBGYN about the fact that, yeah, I'm gonna keep coming to you even if I'm using this differently. I'm using this to practice having a child, but not actually have one. What are my risk factors in that regard? We can have this conversation without ostracizing our childless women like myself, who I'm the biggest maternal advocate I know, but don't have any children. Not sure if that's even for me. So
yeah. So that's an interesting question too, because just recently I had a conversation with a couple of young ladies, and they're in their 40s, and neither of them have children, but they are the greatest godmothers you ever wanted to see. And so I liked how you talk about the village, bringing all of the community in. And sometimes I don't know if we think about it in that way, but they've chosen at this point, they didn't want to have children early, and may not ever want to have children But they are actually wonderful parents. They make really good decisions about how to work with the birth mom to help navigate some of the challenges that they have, because they give that altering perspective. So I do think it's quite a different space, because traditionally, if you didn't have a child by the time you were or get married, then you're the old maid. And even though those terms aren't used anymore, it's still sort of that stigma, like, what's wrong with you? But if young women become more confident and say, nothing's wrong with me, but this is just my choice, and be okay with that choice, they still have so much to give in terms of being able to nurture children in the world.
Yeah, and I normally say, like, aunties are like the beacon of the Black family, like that auntie that don't have kids, the rich auntie, or like just moving away, like even if you don't have kids, you're a caretaker. You're paying for somebody's tuition, I mean, look at Oprah, she's paying for all these people's tuition, you're still a beacon in the village, in the community, and why not bring them to the table?
I couldn't agree even more. That's really how we came up with the name of our program at Revive. It's actually called the Revive Village, because we know it takes a village. And so obviously when it comes to the health of the baby, it starts with the mother. And so we start with the mom, making sure that she's completely educated, that she's connected with resources to help mitigate any outside stress factors. But then we also enroll her into our Baby Bucks program, where she gets educated on everything from the different tests that you get when you're pregnant, your rights returning back to work, obviously postpartum and breastfeeding, and how to manage stress. And so when we start with mom, we know that it'll trickle down to the household. And so it definitely takes a village for sure when it comes to raising that little bundle of joy. My next question, and I kind of want to wrap up with this. I think this is a great question as it pertains to this month being Women's History Month. Who are some of your maternal health and reproductive justice sheroes, especially those who may not be well known? How do you resonate with their leadership, and how can we amplify their legacy in our present day work? So who are some of y'all sheroes in this space?
I'll start. I have a few, and the few that I have kind of have something in common that I think I also have in common with them. So I kind of go past, present, and future with the few that I'll share. I would say Miss Fannie Lou Hamer. And the reason why I really gravitate toward her story is that she wasn't necessarily intentionally going into civil rights to be a maternal health or women's health, maven. In fact, her story starts with her not necessarily knowing if she wanted to go into the civil rights movement at all, and sitting in the back, listening, being a little bit older than some of the freedom fighters at the time, and, kind of deciding if this was a good fit. And just that, I resonate with, because when I came into the environmental justice movement, I didn't know anything about this. And I definitely, being that I'm originally from Seattle and not from our namesake city, Flint, I also want to make sure I had a level of authenticity. And I think that's something that I really appreciate about, Miss Fannie Lou Hamer, is that she decided, after getting the information, asking the questions, and meeting the people, and saying, you know what, this is where I need to be, where I need to use my voice. And, someone who was beaten by the police, who, who didn't ask for and had a hysterectomy, as someone who was, mistreated time and time again, lost her eyesight, all these things. for the greater good, I don't know if I could do that. I mean, I really don't. For someone else, I don't know that, but she assessed and she said, you know what, this is worth life or limb. And and once again, somebody who I think is not well known, someone who approached the Senate, the president of the United States, spoke, may not have had advanced education, but said, I'm going to use the gifts that I do have, despite, those who judge me. I also very much, and not just as an individual, but as an organization, we amplify the life of Corinne Gaines. And, the fact that she lived a short life where she demanded to have autonomy over her motherhood and to raise her son the way that she felt was safest based on her experience in Baltimore, based on trying to protect her children or from her son from the Baltimore police, who eventually ended up taking her life. And so, this idea of finding the power through art, she was a poet, and she was just a beautiful woman, so full of potential. And then I would say, kind of this next generation of moms, if you will. Y'all know how much I love Anna Rodney from an organization called Mom Cares in Baltimore. And she does great work around Black mothers who have children in the NICU. And that is, a population of moms that kind of end up in this environment, a very tricky environment where the same people that you're entrusting the life of your child to are sometimes the same people not giving you access to your child. And kind of like, what does this dynamic of family look like in your child's first few months when you may not be able to bond traditionally, or you may not be able to feed your child traditionally, and you may not have those same rights as, let's just be real, white moms with money. And if if your Medicaid is covering this, how are you treated? And so I've just been so in awe getting to know her and her work. And any person actually across this country that does work in this very touchy and tricky environment of the NICU, where there's a ton of policies around access, but there's so much that can be done to advocate for families, because the risks of having a small baby or early baby are so much higher for Black families. So that would be my answer.
I can go next. Similar to you, Vanessa, I have a few, but number one, it would definitely have to be with, it would be the women that I'm working with. Like, I do believe that what I call like being a part of the welcome committee and seeing them getting the birth that they ultimately wanted really like advances them. They think about all the things that they can possibly do, right? They go back to school, they leave that abusive partner, they open up businesses only because they had the birth that they wanted, right? They thought that they weren't able to do it, and now they see any endless possibilities. So it would definitely be the women that I work with. And historically would be Harriet Tubman. She was a spy and she was a nurse. And she was a go-getter, you ride with me or not, this gun is not for plantation owners, it's for y'all, if y'all not a part of the mission. So they kind of resonates with me. And Sojourner Truth, her navigating motherhood and also work, and also not being seen as a person. So that resonates with me as well. Ain't I a woman, So those are my three pockets of people that I admire.
Yeah. So my shero is a woman that you won't find in any history book. And unless you look real closely, you would probably never hear her name. But she was my mother, Dr. Martha W. Coleman. She birthed 11 children in a time when, and they were stair-step, 11 children. Was pregnant with a set of twins, and they never told her that she was pregnant with a set of twins. They asked her a question: did you have twins in your family? Anybody have twins? She said no. That was the end of story. but go to the hospital, and one came out. 5 minutes later, here comes number two. So it was a time when it was really difficult for Black women, even in the medical world. But what impressed me the most after raising her, and while raising the 10 of us, we had one loss. She lost an infant, so we experienced the infant mortality statistic. My older sister died at about 5 weeks old. But the interesting thing about her was she had a passion and a caring for young women who were pregnant, especially those who were pregnant and didn't have, in the old days, they said out of wedlock, they didn't have the kind of support, right? But she had such a passion for them and would nurture them and walk them through some of the challenges that they would face. And even after she was older, felt as if she'd given all, because all the children are grown, she's an empty nester. She spent time at the rescue mission working with women who didn't have support and teaching them not only to love themselves, but then how to love their children. She was very passionate that you love your children, but you love your children because you love yourself. They're an extension of you. So I honor her in this Women's History Month, and I lift her up as a shining example for me of how to care beyond yourself, care for yourself, but care beyond yourself in such a way that you can see the fruit of that by the generations to come. And so Fannie Lou Hamer says, sick and tired of being sick and tired. I'm sick and tired of this infant mortality rate and this maternal mortality rate continuing. So I'm trusting that the things that we work to put in place today, we will find ways to make sure that they are institutionalized. And I mean that in a positive way, but that our communities really grab a hold. And we do that by really understanding the power that we have as a people and embracing that and ensuring that we share that with others so that our legacies continue.
That was beautiful. I would have to say for myself, I'm like Miajanell. Like, I am completely inspired and encouraged by our moms that are within our program, our Revive Village program. Many of them come from different, backgrounds, different age demographics, but it is the willingness to try to do better, the willingness of knowing that I'm carrying life within inside of me. And I want to be able to bring this child into the world as healthy as it can be. And I'm just so encouraged by it, especially when you hear some of their backgrounds and some of the things that they're faced with. It's something about that motherhood, even though that child hasn't been birthed yet. It's something about that motherhood instinct kicks in, even in carrying the child, knowing that you have to provide a healthy environment. But more importantly, as you said, Ms. Yvonne, taking care of yourself first, because that child is within you. And I'm encouraged by you all, the work that each of you do in this space and being a voice for the voiceless, making sure that moms know about your services in terms of being a doula, knowing about that you can actually get into this space of advocacy and actually help change laws so that moms have a better birthing experience. And then also, to your point, Ms. Yvonne, just being in a space where you want to see better for your community. You have been in Flint for some years and actually has worked closely with Revive. And so I know personally your commitment in this space to make sure that moms have a healthy process, but then also make sure that we have programs around that offer services to moms. So kudos to each of you all for the work that you do, and I am definitely inspired by it. As we wrap, I would like to thank our panelists for sharing their wisdom, knowledge, and nuggets with us today. Just take a few minutes and please remind our viewers how they can follow your work. and any social media handles that you may have for them to reach out to you.
Y'all already know how to get in touch with Black Millennials for Flint. So continue to follow us, continue to engage, continue to tune into Black Girl Blueprint. And if you are outside, we have our beauty shop talks coming up in a city near you every Saturday of the month of March, as well as a couple Saturdays in the month of April. So we had Memphis, we have Flint this week. We'll see Baltimore in a couple weeks, and we'll see DC a couple weeks after that. So continue to follow us on social media.
Awesome. And then I can be reached on Peake Wellness_TN on Instagram. We have a few things that's coming up for Black Maternal Health Week, which is April 11th through the 16th. So we're going to have a baby shower and all those things. So check us out. Yeah, we're just growing, and I'm incredibly grateful.
I can tell I listen to you all in these handles. I got to work on that. But National Center, you can reach me in National Center at aahc.org, National Center for African American Health Consciousness, because again, the awakening begins with you.
Awesome, awesome. Well, thank you to you, our viewers, for tuning in. I look forward to you joining us in April during Black Maternal Health Week as the Black Girl Blueprint to Maternal Health shares reflections on 1 year. We have made it 1 year of Revive serving families in Flint over the past 8 years of the Flint water crisis. Please continue to engage with Revive and Black Millennials for Flint on social media. And don't forget to share this episode. Let's make sure we get this most important information out to our community and to the ones that we love. I am, again, Catrina Tillman, Executive Director at Revive Community Health Center. Thank you again for tuning in.